Good morning, everyone. Please take your seats. We're going to begin our program. Good morning and welcome. I'm Sarah Cott, SVP of Programming at The Hill. Thank you to everyone joining us online and in the room for our event today, Trust in Science, the high-stakes game for U.S. public health. I'd like to thank our sponsors, Alliance for Aging Research, for their support of this discussion. As health misinformation continues to spread, America's overall trust in medical science continues to be lower than before the pandemic, according to a recent Pew Research Center study. It is no surprise then that as misinformation fueled ongoing vaccine hesitancy in 2024, whooping cough and measles outbreaks surged 4 times higher than the year before. Public health has more than a public relations problem. The consequences are deadly. What damage has already been done and what challenges lie ahead? Before we get underway, a few housekeeping notes. If you're here with us in the room, please turn your phones to silent. You're welcome to follow the program on social media. You can follow us on Facebook, X, and Instagram at The Hill Events using the hashtag HillHealth. And with that, I will hand over our announcer to introduce our first segment. Thank you.
Thank you, Sarah. We will begin the program today with our sponsor segment. Please welcome to the stage Sue Peshin, President and CEO of the Alliance for Aging Research, in conversation with Sarakshi Rai, Director of Audience Development at The Hill.
Nope.
Just adjusting. Good morning, everyone. Thanks so much for being here with me. And thank you so much for being here with me, Sue. A pleasure to have you on stage.
Thanks for having us.
So getting right into it, since we only have 10 minutes with Sue here today. So why today's topic? What does trust in science really mean to you?
Yeah, well, so our organization's mission is really about changing the narrative to achieve healthy aging and equitable access to care. But right now, we all seem to be following different narratives, depending on where we consume our information. And it's really the deep divisions that have occurred as a result of that concern us. To be clear, it really has nothing to do with asking questions, because that's what science is. It's really about losing our collective agreement on who's considered an expert and who's worthy of our trust. Social media, politics, and the competing forces in healthcare have really grabbed our attention with a constant barrage of conflicting information, and it's hard to figure out how to reconcile it. The decline of trust in the federal agencies especially concerns us. There's really brilliant and very good people at the National Institutes of Health, the FDA, and the CDC, as well as other health agencies. And we should value and support their expertise because they help keep us and our families safe every day in big and in small ways. And if there's an upside to the fact that we have a national problem with trust, it's that we're aware of it. There was a Pew Research Center survey that found about 2 in 3 Americans say it's very important that we raise the level of trust that we have in the federal government. And 58% of Americans also say it's important to raise the level of confidence that we have in each other. And around 9 in 10 think that we can make progress there. 2 of the most mentioned suggestions for changes we can make, and I don't think this will surprise people, are being less partisan with each other and embracing values such as honesty and kindness. And we agree with the American people, so hopefully this is a step in that direction.
Definitely. Now, we know this is round 2 for the Trump administration. In the first administration, the alliance was actively supportive of Operation Warp Speed, not only to develop vaccines, but also therapeutics against COVID-19. Why was the alliance so supportive, and how would you like to see the second Trump administration build on their previous successes?
Yeah, I mean, Operation Warp Speed was one of the greatest public health achievements in modern time. No vaccine in history had been developed in under 4 years, and many believed that a coronavirus vaccine could take as long as a decade. But President Trump's administration did the impossible, and they produced multiple safe, effective, and life-saving vaccines in under a year. And the National Institutes of Health estimates that Warp Speed saved 140,000 lives in the first 5 months of vaccine distribution. So we wholeheartedly supported Operation Warp Speed because older adults were, and they still are, at highest risk of hospitalization and death from COVID. In fact, more than 81% of COVID deaths in the US have been among older adults. We partnered with Operation Warp Speed to encourage older adult participation in clinical trials. We also worked with the FDA and CDC as they moved through their recommendation process. What was also remarkable was how the last Trump administration slashed through regulatory red tape. They forged historic partnerships with the private sector, and they harnessed the resources of the federal government, particularly at HHS and the Department of Defense. So we need to take the lessons learned from Operation Warp Speed and apply it to future pandemic preparedness and response.
And your organization has worked to combat both misinformation and disinformation. So how can we know who to trust and what information is reliable?
Yeah, it's a good question. So the Alliance is part of the Coalition for Trust in Health and Science, which has more than 90 nonprofit members. The American Public Health Association is speaking here today, and I know there are a number of groups here and probably watching that are a part of it. And the coalition's mission is to rebuild trust and combat misinformation for the good of the nation's health. And they have a lot of good materials, including tips for consumers on how to navigate trusted health information. And folks can check them out at trustinhealthandscience.org. Something that I think they explain really well is that human beings have been spreading misinformation really since we began communicating with one another. So it's not a new phenomenon, right? Anybody who loves gossip. It's our ability to amplify that misinformation on a really large scale so quickly and repeatedly that we have to grapple with today. Now, in terms of where folks can go to for trusted information, the National Institute on Aging, which is part of the National Institutes of Health, is a great place to start. And they're at nih.nia.gov. And in their Healthy Aging section, they have a really good webpage called How to Find Reliable Health Information Online. And the Centers for Disease Control and Prevention website at cdc.gov is another really good place to go. But I want to say something that we think is really important, which is no online information, even if it's accurate and trustworthy, should replace seeing a healthcare professional who can thoroughly evaluate you or your loved one and provide specific advice. So please discuss what you find online with your doctor before making any changes in your healthcare.
And lastly, how does your work address issues of personal freedom and autonomy in healthcare decision-making? Do you see these as opposing issues, or can a person exercise their right to freedom and autonomy while also protecting their neighbors?
Yeah, I mean, this issue really hits home for us as an organization that's focused on aging, because the way that a lot of people speak to and treat older adults is often ridiculous when it isn't downright insulting. So two of our values as an organization are dignity and empowerment. With dignity, we believe everybody deserves to be respected and appreciated for their unique humanity and their inherent value regardless of their age. And in terms of empowerment, we aim to provide older patients and family caregivers with evidence-based information, and that will help them make informed, independent choices that allow them to self-advocate and improve their health outcomes. So we don't see freedom and autonomy being at odds with public health at all. We see public health as integral to freedom and to our democracy. The thing is, I think everybody gets defensive. You know, it's natural, and we shut down when we're treated like we're incapable of making our own decisions. But when it comes down to it, we generally all care about the same things: the health and well-being of our families and our neighbors. So we need to find our center again, and that's why we're here.
Well, thank you so much for that, Sue. That was great insight, and I hope you guys all learned something from that exchange. I'm going to hand it over now to continue with the programming for today.
Thank you.
Thank you to Alliance for Aging Research for sponsoring today's program.